when I got into aesthetics several years ago, what I had thought about actually was this sucks. I don't feel like I can do all this stuff for people. I need to get all these authorization forms done. I can't come up with enough samples for thousands of people. I was really super frustrated, and what I found was that having that adversity forced me to look at other things that I was able to do. If I was 100% happy with being a regular HMO doctor, I never would have pushed myself to learn other things or to do something outside of my comfort zone. So when I really started looking at other procedures, really when I started doing the cosmetic medicine, it was out of dissatisfaction with the way medicine was going. And I guess my point of this is that when you have something adverse happen to you, there's different ways to go about dealing with it. The way that I've tried to deal with it in my life is to figure out how can I work with it to make it into a strength. What can I do to teach myself something else, learn a new skill or something that I can utilize it, because I want to love my life. I want to live that dream. I want to do all these things that are full of joy. I refuse to settle into a life where I hate my job. I hate going to see patients. The one thing that aesthetics has allowed me to do is to set my own hours. So if I want to spend 3 hours with one patient, I can do it. And that's what I love about it.
What got you into aesthetics?
Well, again, the dissatisfaction with medicine, and then actually at that time a colleague happened to get Botox injections. And she said, my migraines went away for 3 months. You have to learn how to do this. And that actually led me to look for a training course when she said that, how to inject Botox. I mean, my initial, it wasn't really for aesthetics. I was really learning to treat migraine. I have a lot of migraine patients. I suffer from migraines myself. And I'm thinking, I have to learn something to do with this. I was on prophylactic beta blockers for 3.5 years. And on a bad month, I would say I had 15 out of 30 days with headache. I wouldn't go anywhere without my Imitrex. I lived around the headache. I always, I would avoid certain foods. I would eat at certain times. I mean, your life revolves around that pain. And I didn't want to do that anymore. So I learned really initially how to inject Botox because I wanted to learn how to treat myself. And when I learned that, patients heard and they started asking me, well, can you do my wrinkles? Can you do my lips? And I thought, well, I do circumcisions. I do biopsies. I can certainly learn how to do those things too. So I just started taking a bunch of courses and started working on people. And
do you still do circumcision?
I actually do. I'm
Yay! Sorry, going back.
That's okay. But that's really kind of how I got into it.